Okay, so if you've seen some of the prior videos, you will remember that I talked a little bit about what we do with the skin, but then also what we do with the deeper tissues. And again, I'm talking about the face for the time being. So, a facelift, a well done facelift, isn't just removing some skin and tightening the skin. That's actually what creates a very unnatural look, because you're relying on really tight pull of the skin to try to lift the underlying structures, and that pull creates distortion and can really make the mouth look stretched out. And unfortunately also, because there's a lot of tension on the skin, can make the scars migrate and also look wide and unnatural. And also the kind of lift that that creates just does not endure. So really a lot of the action in the facelift part of a face and a neck lift occurs beneath the skin. So in order to get beneath the skin, we make the incisions that I referred to in a prior video, and then we lift the skin off of the deeper tissues. And the tissues that we're lifting the skin off of are really sort of fatty tissues and then collagen-rich tissues called the SMAS. That is a netting that helps support the fat, the malar fat pad, and the underlying muscles. And as we age, just like everything else, that SMAS ends up loosening. And as it loosens, the structures that it was supposed to support in youth no longer are supported. And again, we see drooping of the tissues down onto the jaw, hollows in the upper cheek, because the cheek tissues are not supported there well anymore. So often, or I should say often, always in a facelift, or at least the facelifts that I perform, we're doing something to the SMAS. And there's three different things we do. One thing that we do, or that I do, is what we call a SMAS flap. Well, in a SMAS flap, what we do is we make an incision. This is not on the skin, but underneath the skin within the SMAS. We make an incision basically from the cheek out to the ear and then down along the neck. And we carefully lift that tissue off of the underlying tissues, off of the muscle, off of the parotid gland, taking a lot of care to make sure that we're not injuring any facial nerves. We lift it up and then we reposition it and suture it in a higher location. And that gives a lot of really wonderful support to the central cheek, to the malar fat pad all together. And then also even elevate some of the tissue off of the jawline, and even gives a little bit of a lift to the neck, because the SMAS is contiguous with the platysma muscle, which is the superficial muscle layer within the neck. So that's a SMAS flap. The second technique that I use to address the SMAS is what we call a SMAS plication. A SMAS plication means using some sutures to tighten the SMAS. The SMAS has a mobile portion, which is in the lower, more central portion of the cheek, and then it has a more fixed portion that's a little bit further out and up. And in some patients, usually the thinner patients, it makes sense not to do a SMAS flap, but to reposition and tighten, bring together. That's what plication means. The mobile SMAS to the fixed SMAS. It provides a really strong, supportive result. And the reason I like it for thinner patients is that what you're doing is you're really kind of really repositioning and almost augmenting the upper and the lateral cheek by bringing those tissues together. Instead of creating an overlap above where there is a hollow area, you're really bunching those tissues together in a very precise way, a very smooth way to augment that area. Again, and that's why I like it for a thin person. For someone who's really heavy, I will consider the third option, which is a SMASectomy. So what a SMASectomy is removing a wedge of SMAS. Again, this is all underneath the skin, that follows this oblique angle. Really, it's at the junction of the mobile SMAS and the fixed SMAS. And the benefit of doing that in a person who has a heavier, fuller figured face is that you're actually removing a little bit of excess bulk, excess SMAS, excess fat, and then bringing those two edges together. And as you can imagine, if we're removing something, it has a thinning effect. It makes the face look slender, while at the same time providing the same level of support that we often can achieve with the SMAS plication or the SMAS flap. Again, with the SMAS flap and with the SMAS plication, we're not removing any tissue, we're just repositioning it in different ways. But again, in a fuller figured person with a fuller, heavier face, if we want to take the surgery, the facelift operation, as an opportunity to make the face look thinner and make it look as if the patient has lost some weight, the SMASectomy is a really wonderful way to go about that.